Good morning, everybody. It is 10 o'clock, so for the sake of time, I think we will go ahead and get started. We're really excited to be here with you today to talk about all things about teenagers. So we're just, we've titled this presentation, Let's Talk About Teens. So we're going to talk about lots of different things that kind of impact the care of adolescents, and hopefully you'll walk away today with some information and comfort in regards to this really special and unique population. My name is Dr. Khara Breeden. I am the founder and CEO of Texas Forensic Nurse Examiners, the Forensic Center of Excellence. We are a community-based forensic nursing program based out of Harris County, but support 9 counties around us with forensic nursing services and several other programs that we have grown and launched into. So we're really excited to be here with you today. And with me as well, I have Amanda Amore.
Hi, my name's Amanda. I'm a forensic nurse here at Texas Forensic Nurse Examiners. And I have been here since about March, and I've been a forensic nurse for the past couple of years.
And also with us is Michaela Clark.
Hi, everyone. My name is Michaela Clark. I recently joined the Forensic Center of Excellence. And previously to this, I was a human trafficking prosecutor in Harris County for about 4 years.
Awesome. So as we kind of get started here, before we get started, I'd like to just do a couple simple polls. Kristen, can you launch the first one? The first one really is just so we know who we're talking to. If you can just answer the poll that just popped up so we know what specialties we are working with today. All right. 49 of 51. Looks like we primarily have advocacy with us, so we are super thankful. A couple from campus-based areas, and a couple from the criminal justice system. So we're excited to share this information with you. I think we have one more poll, just as it relates to Kristen. Do I hit stop sharing this?
No, I'm gonna stop sharing.
Okay.
Yeah.
The second question will just relate to your overall comfort with taking care of the adolescent population. So as we're walking into this, we kind of understand everybody's background and comfort level in general with this targeted population.
Okay, just give me 1 second for this one, Khara, if you don't mind.
Oh yeah, no worries.
Okay, so it looks like that question isn't gonna pop up at the moment, but y'all can keep going.
Okay, sounds good. So again, just briefly on, we all are employees here at Texas Forensic Center of Excellence, or Texas Forensic Nurse Examiners, excuse me, Forensic Center of Excellence. And our mission is through a coordinated community response, the Forensic Center empowers victims, promotes healing, and creates innovative and comprehensive solutions to fill gaps in victim services. So we started as a community-based forensic nursing program and have extended into providing advocacy, counseling, adult forensic interviews, and most recently, legal advocacy for our survivors that we care for here at the Forensic Center as well. So we're excited to be with you today and share a little bit about what we know about adolescence.
Okay, I'm gonna Go ahead and launch that second
Okay, cool.
poll.
Perfect.
All right.
So here's that second poll. How comfortable are you working with adolescent survivors? We have a really good mix. This is exciting. Awesome. So most of you are somewhat comfortable, a couple that are not comfortable at all, and then some that are super comfortable with this population. So I love the mix of the group that we have. So it'll be, this will be fun. Let's see. Stop sharing. I don't know how to get rid of that. There we go. It's going to keep popping. Okay, there we go. All right.
So in order to promote optimal health in our adolescent population, it's very important to help them acquire power, authority, and opportunities for them to make choices that increases their own likelihood of positive expressions for healthcare for themselves. So we want to make sure that they feel empowered and that they're able to kind of come to us and talk to things and get answers, and we can kind of guide them in their own health, because we can't make those choices for them, but if we empower them to make them for themselves, they are more likely to continue on a positive path later. So these are different issues that should be addressed when you're dealing with adolescents. You want to address not only their physical growth and development, but also, how are they doing in school? How are they doing in their social groups? Their emotional well-being. We want to talk to them about reducing risk in their lives, even if something simple like wearing a helmet when you're riding a bike, different things like that, to kind of promote overall health.
We know that our adolescent population, their biggest focus really during this period of time is figuring out who they are. And many of their behaviors, things that they do, some of the bizarre things that you might have to figure out what their thought process was, or activities they're involved in, friends that they interact with. All of these things are really a bigger part of that teenager or adolescent figuring out who am I? Who am I going to be? What do I believe in? What do I stand for? How do I interact in this space in the world? And so really and truly, most of the things that teenagers and adolescents are faced with as far as decision making, it all is going to stem back to them really trying to figure out who they are and how they're going to be in this space. So I have to take everybody back on a walk on memory lane. I know most of you have probably had this type of training in your school, wherever that was, and whatever type of educational background you've had. But we have to go back and talk about theoretical development stages. And when we talk about adolescence, the one that I feel like most stands out is Erickson's theory of development, where he talks about identity versus role confusion. It's really during this stage that teenagers, again, develop a true sense of self. They see themselves as a separate person versus like a part of their family. They're really developing their individual self. They're able to differentiate between themselves and their friend groups, their family groups, and things like that. Obviously, this is not probably new knowledge. Peers are super important at this phase of their life. They really do a lot of comparison, compare and contrast to themselves and their friends. So things that they, this is where clothing and social media, which we'll get to in a minute, all of these factors kind of come into play and part of that process of like comparing and contrasting to peers. And one of the harder things these days is that peers are now an extension of not only their peer groups that they know personally, like in school, but peers are also going to be extended to people that they know on social media. These people also become their peers, whether that's a good thing or a bad thing, depending on what type of social media they're involved in. This can significantly impact this process. Obviously, body image is important to adolescents. This is when, this is the biggest period of growth besides infancy. So their bodies are changing. They've gone through puberty. They're getting breasts or facial hair. All of these things that are changing in this adolescent stage are really going to impact their overall how they feel about themselves. Again, this goes back to that compare and contrast. So if they're heavier or taller or shorter or all of these things, they're going to compare themselves to the people that are around them. So we'll break this up into 3 stages, as Erickson did. In early adolescence, so really it's a period of conformity. So in this stage, you just want to be like your friends. You don't want to stand out. You don't want to be different. You kind of just want to wear that cool shirt that everybody else is wearing. You want to have those specific shoes that are in style. You don't want to be different, right? You want to blend in as much as possible. So when you have a child or an adolescent in this stage that does have something that makes them stand out, this is where they can really struggle getting through this phase in their life. Then we talk about middle adolescence. It's really a period of challenge. So this is where we really start seeing teenagers push the boundaries. So they're going to start questioning things. They're going to start challenging their parents' rules. And then you'll start seeing risk-taking behaviors as well. And then in later adolescence, they consider this a period of individuality. So successful completion of this phase is contingent on the ability to learn from experiences. So we're hoping that in this stage, these adolescents have done this well, and they can transition into a successful early adulthood. And this is really when relationships start to get more serious. They have more one-on-one relationships versus a larger peer group. Just to kind of reiterate social development, during this phase, relationship with parents. So obviously in the beginning, the parent-child relationship changes, right? So, when they're children, there's a dependency on parents for protection, for everything really, right? And so as they start to get older, you can see that dynamic change, and you want, adolescents are going to they want to be equal with their parents, which they want to be able to help make their own decisions. They want to be, less dependent on that parental relationship. And then relationship with peers, obviously, like I said, peer groups help with this transition. So this is where it becomes really important to make sure that peer groups are positive peer groups, that, parents are involved and they understand what those peer groups are doing. Because this is what the biggest influence in this age for adolescents. Whatever those peers are doing is likely what that particular adolescent is also going to take on. So in their school, and if they're working outside, if they're teenagers and have a job, these are the little microsystems where their peer groups are formed. So again, can have a huge impact on the person that they're becoming as they are figuring themselves out. Interests and activities are really important. So if you have adolescents that are in band or gymnastics, these types of activities, this becomes really important in this age. And then adolescents spend a large amount of time engaging in leisure time activities. So this really does impact who they become. And again, social media has a very large impact on this, but we're going to talk about that more in just a minute.
So how can we best communicate with our teen population? The first most important thing is to listen. Let them know that you're there to listen to them and that this is their time to talk. It's important that you're not interrupting. You can save your, if you have a question about a name or an age or different things like that when you're speaking with them, it's important to wait until the very end to ask them their questions. That way they know that you're listening to them. You want to provide privacy. Make sure that you're asking them important or embarrassing questions in private. You can have the parents leave the room. Different things like that. You want to validate what they're going through. So make sure that they know that you understand what's happening and that you're there for them, really. You want to keep your trust with them. It's really important that you don't go against like what you've already set out. So it's important to set out some ground rules when you first start talking. If you tell me that you want to hurt yourself or hurt someone else, those are things that we do have to talk to your parents about. But other than that, we can keep most of our conversation private, and you want to make sure you don't go against what you told them. You want to make sure that you let them be a part of the decision making and the steps in your exam and different things like that. Instead of telling them we're going to do this, this, and this, let them decide, do you want to do your blood work first, or do you want to do a certain part of the exam first? And then you always want to offer praise when you're able to, even if it's little praise, like, I'm really proud of you for doing all these extracurricular activities in school. Or even if they tell you, I do have sex and I have sex with my boyfriend, but we always use a condom, you can praise them in that. Like, okay, you're having sex, but I think it's really smart that you're using a condom. I'm proud of you for making that decision. Little things like that will give them the power back and make them feel important.
And just going back to the trust piece, because I know we have some people like from college campuses here, trust becomes, one of those things, like Amanda said, there's certain things we have to divulge. But as healthcare practitioners, and even when we talk to adolescents, most of what they say, we actually can really keep that to ourselves. We don't have to share that with their parents. We're in this stage where they do deserve to have some privacy, which we'll get into some of those actual laws here in just a minute. But when that becomes sticky is when patients maybe are seen in a hospital system, and maybe the parent's going to get the bill for that visit. Or I always want to be upfront with my patient when I'm seeing them that, I'm not going to tell your mother, father, whomever about your visit here today, but they may get a bill from healthcare insurance. So they may know that you're here for this. So there's different situations where maybe I'm not the person that can divulge that information or will divulge that information, but somebody else or a bill or another system that does interact with the parents. Sometimes there's those factors that we have to consider. So we always want to kind of think about those things and make sure that the teenager or the adolescent understands that. So that way they don't think that you broke their trust, because once that trust is broken and they think that you told their parents after you've just told them that you're not going to, it's really going to impact that relationship and their future relationships, either in healthcare or with advocacy, whatever that is. So we always want to make sure that we're sharing where those trusts can be impacted.
So your first step with any interaction with a teen would be to build rapport with them. Building rapport can be pretty hard if they're closed off, sitting in the corner with their arms crossed, different things like that. But for me personally, I always like to pick something, whether it's their shirt or their hair or something little, their phone case, different things, and like compliment them. Or if they say a word that I've never heard before or like a different slang term, I'll ask them, oh, what does that mean? Can you explain it to me? And then they get to teach me something. And that's kind of a good way to kind of get in their trust and build rapport and let them know that, we're equal. I can teach you things and you can teach me things as well. And that kind of helps begin that first trust relationship with them and kind of open up to the rest of your exam and time with them.
Yeah, that's good. This is kind of a busy slide, but I wanted to include this Texas Family Code in general. But the things that I'm really trying to hone in on here is when we talk about consent, in the state of Texas, once you are in, this 14 and up age, they can go to a hospital or be seen and treated for communicable diseases. So this is why you can have an adolescent that maybe goes to a clinic or a Planned Parenthood and maybe gets on birth control, or maybe goes and has sexually transmitted infection testing or treatment without the parent knowing. It is legal, and if you think about it, it really does make sense, because that's one of those things that's often an issue within that parent-child relationship, and that's not something that most adolescents or a lot of, I shouldn't say most, are really not comfortable having that conversation with that parent. So that, Texas Family Code actually backs them up, so that we can hopefully make sure that our adolescents are being healthy and making good decisions and can seek care for things. Otherwise, we know that there's a lot of long-term health issues that might otherwise arise. So the other thing that they can come in and consent for is treatment or care for issues related to sexual assault or emotional abuse, physical assault. So this makes it to where, you can have even a child that if they are presented with maybe an aunt or someone else, if there's concern for sexual assault, this gives us permission to be able to see them in good conscience that there's a reason that maybe it's a parent that's impacting or doing the abusive behavior. So again, if you have a 16-year-old that comes to the emergency room or to your clinic or some space for a sexual assault exam, it is totally, it's completely legal for us to be able to see them with their consent only. So this is something that is important. It's very confusing, but it's important to know that, these patients can be seen without their parental consent. All right.
Okay, so in the district attorney's office in Harris County, I mentioned I was in the human trafficking department, and then a lot of the cases we handled were sexual assault cases, 14 to 17. And so this is a bunch of legal jargon on this slide, but a lot of our cases, especially our human trafficking victims, were having sex with adults. And so it was important not only for law enforcement, but all of those working actively with the victim to know that despite their consent, under Texas law, this is a strict liability offense, which means that no matter if it was consensual or not, and regardless of whether the individual who is having sex with the juvenile knows their age at the time of them having sex, it's still a sexual assault, and the individual who is having sex with the juvenile can still be held accountable, and we can still file charges, even if that adolescent was agreeing to the sexual encounter. So again, just the age of consent to this sexual activity in Texas is 17, and then non-report laws require the victim to be 18 to not report sexual assault to law enforcement.
Which is super confusing.
Which is very confusing.
Yeah.
So again, being a lawyer and all the legal jargon. So Title V, Chapter 22 and Chapter 22 sexual offenses, that age of consent begins at 17. But when we talk about human trafficking offenses that are found in Chapter 43 of the code, that's when we're talking about under 18. So unfortunately, the legislature hasn't been consistent in how they define our children, but it depends where you're looking at under the code. And we'll get to human trafficking offenses in a little bit. And then this is just something important to know. That's one of the defenses that is commonly used. Prosecutors know about it. So when an officer is presenting a sexual assault charge 14 to 17, that the prosecutor is looking to make sure it doesn't fall under this Romeo and Juliet exception. And that exception basically is that the actor, so the individual who is having sex with the juvenile, was not more than 3 years older than that victim at the time of the offense, and the victim was at least 14 years old at the time of their sexual relations. So if both of those things are happening, then prosecutors and law enforcement should know that we're not going to file that offense because it falls under this Romeo and Juliet law, and it's a defense to that sexual assault 14 to 17.
Kristen, are there any questions before I kind of go on? Because I know that was a lot. I just thought I'd check in.
No, not so far.
Okay. Okay, so now we're actually going to get into the medical forensic exam and talk about some of the specifics related to the exam that as an advocate you might be a part of in the hospital system. We always, just as a brief overview, like to say that our medical forensic exam consists of 7 parts, and I'm not going to go into each specifically, but the first being informed consent. We talked a little bit about consent already. The second is the medical forensic history, the head to toe assessment. The 4th part is the detailed anogenital exam. 5th part is evidence collection, if that's applicable to the situation. The 6th being medical treatment and medication, and then 7th being safety assessment and discharge instructions, which is a lot of where we do teaching and things like that. So we'll go into a few of these, but not all of them.
So there's 2 different types of exams. You have an acute exam and a non-acute exam. And really the only difference between the two is when it happened. So for an acute exam, it happened less than 120 hours, which is 5 days. If the victim's been on the streets, human trafficking, different things like that, you can actually consider longer, if they haven't showered, different things like that. So you can always use your clinical judgment when seeing these patients. For the acute, you would do the full evidence collection, STI testing, and treatment. And then for a non-acute, you do the same thing except no evidence collection. And then you can hold off on medications for STIs until their lab work comes back, unless you think that they're high risk, they might not follow up again, different things like that. So like I said, clinical judgment is always the most important when you're with these patients. But the main difference between acute and non-acute is the time frame and evidence collection.
Confidentiality, like we were talking about trust earlier, really we need to really stress this in this environment. As you guys sit through this presentation, you may have more information on this subject matter as you sit as an advocate with an adolescent receiving an exam. So obviously when we do an exam, it is very sensitive information. We want to make sure that teenagers feel like they can trust us. We want to make sure that we don't have a space in the healthcare system where we are creating distrust in that system, because it really can impact future healthcare interaction. And so I think it's important, if you are in a space, I'm just going to give you a little story. I was doing an exam years ago, and you may very well have more information than even the residents that are there. So I had this resident that came in. I had a 16-year-old patient. Her grandmother and her mother, she was sexually active with previously, before the assault had happened. She had disclosed that to myself and obviously the resident prior to when I had gotten there. But her mom didn't know, right? So she told me this during the exam, like that she was sexually active, but her mom didn't know. And I was like, I'm not going to tell your mother that. That's between you and your mom. That's not a conversation I'm going to engage in. And so this resident, I was kind of closing up, doing my discharge instructions, things like that. And the physician came in and actually in front of everyone starts talking about safe sex and lecturing her about being sexually active. And I interrupted her and told her, that she needed to stop talking, essentially. And that was her private information. And so it turned into this kind of like a heated space, but I just felt so bad for that patient at the time, because she was, I can't imagine how that would feel to have someone come in and disclose such personal information with your mother and your grandmother even there in that room. So as you are taking care of these minors, make sure that you're an advocate in that space, and you may come up with a situation that's similar to that, and you might have to speak up and speak out for that adolescent's confidentiality, because that is information that doesn't need to be shared with the entire room. So kind of keep that in mind as you're interacting with these victims in whatever setting you're working in.
So different considerations to take in while you're doing an exam for older children and adolescents is you want to ensure modesty and privacy. Make sure that you're keeping them covered when you're looking at different body parts. You want to offer them choices, do you want to do the exam first or blood work first, different things like that. If they're like a younger teen, you can explain different body parts and functions. Or even if they're an older teen and they have questions about different parts of their body, you can answer all those things. You let them decide if they want their parent in the room or not. That's not your decision to make. And then you want to reassure normalcy. So whenever I do an exam, especially an anogenital exam, after I always tell them, your body looks healthy, your body looks normal. I didn't see anything for you to be concerned about. and let them know like their parts look like everyone else's parts. And that kind of helps them, you know, just feel reassured that everything's okay and that they're just like everyone else. You know, going back to they're just trying to be like their peers and different things like that.
Yeah, especially when you talk about sexual assault and they feel like maybe they're
Yeah.
broken. And we're going to kind of go into this whole theory of the hymen and some of the information that is actually very common in our culture. So that is commonly one of the things that teenagers are most worried about in a sexual assault is, you know, their bodies, and if they've become sexually active, even if they weren't previously sexually active, because of this myth of this hymenal structure.
Yeah.
Do you want to?
Yeah,
Yeah,
so
so-
one thing I always tell them too is no one will know you're sexually assaulted unless you decide to tell them. They'll never be able to look at your body and know that something happened to you. And then another important thing, especially for our teens that had never had sex prior to being sexually assaulted, is that virginity is something that you choose to give to someone, not something that can be taken from you. So if you didn't choose to give your virginity away, then you're still a virgin. And that's, you know, if that's what it's important to that teen, it's important for them to hear that, to know like they didn't choose to give it away. It's part of your heart, not part of your body. So one one question that we get asked all of the time
Mhm.
is, are they still a virgin? Can you look at my daughter and make sure she's still a virgin, or did penetration happen? I would say those are probably our most common questions. And so there's no way that you can look at someone's body and know if they've had sex or not. When moms in particular come in and ask, you know, is my daughter still a virgin? Can you tell me if something happened? I always like to tell them, you know, there's nothing on the body that goes away. There's no magical covering that disappears after they've had sex. You know, I'll say either your daughter told me she's never had sex before, or whatever I've talked about with the teen that the teen said I can disclose. And I'll remind them, you know, there's no way I can tell if you've had sex before, and I'm sitting here talking to your daughter, so we know you have. Little things like that to kind of make them sit back and think, okay, like she's really not just trying to cover up for the teen, like there is no way you can tell by looking at their body. And then that kind of brings us into the hymen and what is the hymen. So if you were to Google the definition of hymen, it comes up with a membrane that partially closes the opening of the vagina and whose presence is traditionally taken to be a mark of virginity. So the hymen, that's not the hymen.
Google's got it all wrong.
Yes.
Mhm.
So the hymen is like, we like to say, a scrunchie of tissue that's around like the vaginal opening. So it's just a little piece of skin that goes around the outside. You know, its purpose is to stretch and move with the body, just like everything that goes with the vagina, right? Babies come out of it. Its job is to stretch and to move and to do all those things. So sometimes there might be a little tear. You know, we can tell them that there's a tear, but that tear, I can't tell you how it got there. So it really doesn't provide any answers. So that's what we like to say. It's a little scrunchie of tissue around the vaginal opening. And it's meant to move, so it might not have any injuries. And that's completely normal as well.
I think the biggest misconception of this magical structure that we've all given so much credit is that a lot of people think that it breaks or it ruptures or like it tears, like it, you know, like that it's like a closed area until sex happens, and that's just not true. The hymen is, it's, you know, like Amanda says, it's a piece of tissue that surrounds the vaginal opening. It's certainly not a closure. If it was a closure, there would be no way for periods to come out when they have their first menstrual cycle. And that's just not how it happens. So I think it's really important to understand that early on and make sure that when you have adolescents that you might be working with, that they understand that the hymen, you know, it's given a lot more credit than it is actually necessary. I'm going to skip the video because I think we're going to run out of time. Oh no.
So
Okay,
if you want to look, there's a video.
Yeah.
You can find it on YouTube. What is it called?
It's Adam Ruins Everything. And if you search hymen and Adam Ruins Everything, it's a really cute, funny video. It's about 4 or 5 minutes long, and it really talks about how it's a misconception. So if you are doing teaching, or if you have a group of people that you want to educate about hymenal myths, it's certainly a very fun, easily digestible information on that. So
So when we see our teens, there's different testing that we do with them. We do gonorrhea, chlamydia, and that can be done 3 different ways. You can do a throat swab, a swab on their bottom, or a urine sample. Most commonly, we do a urine sample. If it was just an oral assault or just a rectal assault, then we might consider just swabbing those areas. But you use your clinical judgment for that. And then we always test for syphilis, HIV, and hepatitis C. And it's really important that they get follow-up care with that as well. So you want to make sure they have access to clinics or a good follow-up plan in place. For our acute patients or our high-risk patients that you just know they're not going to get the follow-up that they need, you can provide treatment for any possible STIs, just so they don't have anything to worry about. So we do azithromycin, Rocephin, Flagyl, and then Flagyl, it's important to remind them not to drink any alcohol. It can make them very sick for the next couple of days. We can offer them Plan B for pregnancy prevention. And then depending on the type of contact that's happened and risk factors and all those different kinds of things, we can offer them HIV and PEP, which would lower their risk of contracting HIV from sexual assault as well.
Obviously, because we're talking about adolescence, I thought I should talk a little bit about sex education. We need to really understand that most of our sex education at this point in time is happening through social media or websites. Unfortunately, our adolescents are really mistaken in regards to the realities of sex, right? So they might be learning about sex through pornography. Pornography is very readily available for teenagers to do a quick Google about sex, and you're probably going to pop some pornographic video or something inappropriate very, very quickly and easily. So it's important to understand that because of social media and the internet, they kind of have, a false sense of reality in regards to what sex is, what relationships might look like. And so it's really, as you walk into this space of sex education, you need to kind of have that as your basis, because what most teenagers think is normal is not really the reality of what sex education is meant to be. So that's first and foremost. But the responsibility for providing sex education really needs to be on everybody. Yes, it's on the parents, but we know most of the time that it's not really happening. Schools certainly try, but they give, a very watered down version of sex education, especially if you're comparing that to what they're getting on social media and the internet. But as a community agency or a healthcare provider, you really need to take this role on. If you're interacting with teenagers, you need to be talking about sex. That this is something that they're dealing with, that's on their minds, and being someone that is in this space and has, education on this, you need to be the ones that's opening up this conversation because it's very likely that nobody else has. It's very sex education should consist of normal body functions, and it should be straightforward. So things that are normal and not normal, you have to, again, remember that the information that they're likely getting is very confusing to them. So don't try to, make up, ridiculous words, or be very matter of fact and straightforward. Provide them with information just as it is, even if it's uncomfortable for you. I think most of the time sex education is, not done well because it's an embarrassing topic to talk about. And, most people aren't comfortable talking about, body parts and body functions, but with teenagers, they really, really need that. We need to talk about safe practices. We know that a lot of times abstinence certainly is the safest, but we know with teenagers and their curiosity and things like that, abstinence probably is not going to be something that you're going to be able to talk them into all the time. So what's going to happen to be safe other than that? So we really need to be teaching about condoms. We need to talk about risk factors such as sexually transmitted infections and other things that happen because condoms aren't worn. So these are things that really need to be talked about on a regular basis, not just once. It needs to be a common conversation. So if you have a teenager in your life, make sure you're having those conversations frequently, because those questions are going to continue to arise. It's not a one-time conversation. It's a fluid conversation that should happen on a fairly regular basis. Information concerning anatomy, pregnancy, contraceptives, and STI should be presented in simple and accurate terms. Again, this is kind of going back to what I just said. They have a ton of questions on all of these things. So open up the floor so that they feel safe and they can ask these very sensitive things. And yeah, parents need to understand that normal behaviors, teenagers are curious. They're going to, you know, all of this is just part of normal development. It's not because something's wrong with them or, you know, that they're being deviant in any way. It's all part of a normal developmental process.
No, I can use this one. Yes. I can. Or you want to do it? You go. Okay, sorry. We're both passionate about social media.
Yeah.
So 95% of teens have access to smartphones, and 45% say that they're almost constantly on their phone. So if you look over to the left-hand side, I guess, or right hand, wherever you're sitting, about 45% of teens in 2018 said they're almost constantly on their phone. And that's a big increase from like the 2014, 2015 range. So just social media use has increased so much over the past few years.
You want to add anything to that?
No, I'll talk about that when we get to trafficking.
So for a few different theories on social media, you have the disinhibition effect. So while online, people feel free, right? Like they're sitting behind a keyboard, they're able to disclose things or act differently than maybe they would in real life or in-person interactions, just because they have kind of that protective barrier of social media. And it just allows them to kind of speak more freely. Social media acts as a super peer. So, you know, you go on, you're able to get all of these likes, you see all these people, this is your new community. So they look at each other's photos and they kind of use that to gauge social norms. And then their behaviors are strongly influenced by perceptions of whether their peers are engaging in the same behavior. So, you know, they want to do what their friends are doing. So-and-so is posting pictures at a certain place. They want to go do the same thing. So it all kind of creates just this environment for them where they get all this feedback and they're able to be someone else. So popularity is now measured by the number of friends or likes or follows. They get instant gratification and feedback when they post a photo and they get so many likes or comments on the photo. Adolescents compete for the most likes and comments. And then bolder and more daring behavior is being rewarded. So all these teen challenges that are going on and starting, you know, oh, my friend did a challenge, I'm going to do it too. And look how many likes I got. And it's just this instant gratification for them. And then these are different risky online behaviors. So lots of teens are posting personal information. There's a lot of apps that are like geotagged and people can get on and actually see where that person is in real time. Teens are interacting with strangers. So some of their interactions aren't with even people that they know. You know, random people are messaging them on Instagram, different things like that. And now they have this new friend who they've never actually met. They're placing strangers on like their close friends list. They're actually sending the personal information to strangers. They're visiting, you know, different pornography sites and different things like that. And then they're actually interacting online with strangers and talking about sex with them. So all these different behaviors are happening and that can lead to different things that Michaela will talk about in a minute with human trafficking. And so every day there's a new app. Every time I interact with a teen, it seems I'm learning about a new app. You know, there's just so many different things to keep up with. So it's really important that you have an open line of communication with teens and that you're able to, you know, as a parent, at least see their phone, be involved, know who they're interacting with online, and really talking to your teens about the dangers of different apps. So as an advocate, one thing you can do too when you're in that space talking with a victim of sexual assault is letting them know, some of these apps aren't safe, and kind of going into that with them as well and educating them, because they just think it's a fun way to talk to their friends and they don't really see the dangers behind it.
Yeah. Just as long as that conversation is one that you're not like talking at them, you're having a conversation with them, because otherwise you're just another adult telling them what to do. So again, all on how you talk with that teenager during that conversation, because that's an important one to have.
So, and this coincides really well with human trafficking. And so I know before I came into the human trafficking division in the DA's office, I thought it was people bringing other people from different countries to the US to work either through forced labor or sexual exploitation. But really how we're seeing human trafficking today, especially is these individuals who are targeting our teens are going on these social media sites and befriending them. I know a lot of cases I prosecuted in the DA's office, they would reach out to teens telling them that they were record producers in Houston that could get them jump-started on their singing career, and they would actually go and pick them up in different areas of Texas and then bring them down to Houston, sexually assault them, and then put them out either on the Bissonnette track or other areas of Houston and have them walk, or create social media profiles for them, or post sex ads of them and things of that nature. So human trafficking looks a lot different. But again, it's that transportation, harboring of these individuals and forcing them to engage in sexual exploitation or forced labor. And then these are just some statistics. Luckily, Harris County is doing a lot to combat human trafficking. And like we've been talking,
Texas in
Texas in general. Yeah, it's a collaborative effort. It's not just the DA's office, it's nonprofits, it's advocacy groups, it's medical professionals, it's law enforcement all coming together and trying to help and target these individuals who are taking advantage of our youth. And so just looking at who our population is that's most vulnerable, a lot of runaways, homeless youth, children that have been in the foster care system or the juvenile justice system. We see so many victims of child abuse and neglect that are then brought into this life, and because they were sexually assaulted as a child, they have a different perception of what's appropriate and how what sex looks like to them later on, and how predators just take advantage of that. And then the LGBTQ youth as well. And so looking again, this is another legal jargon slide, but like I was talking about, when we're looking at these offenses, they're either found in chapter 28 or chapter 43. And unlike our chapter 20 and 21 and 22 offenses, a child now is defined as a person younger than 18 years of age. So that's the differentiating factor compared to the sexual assault charges. And it's a person commits this offense if they knowingly traffic a child by any means and causes the child to engage or become a victim of conduct prohibited by. And then you can see there's a laundry list of different ways that the legislature has said this conduct is inappropriate, unacceptable, and if any of this happens, we can arrest someone and charge them with trafficking of persons. And another thing just to highlight briefly, when we're talking about our youth and our children, by any means, so it's any type of conduct that causes them to either become a victim or to engage in these different conducts you see listed out. And so the legislature wrote that very broadly because we want to protect our youth and make sure that these individuals are held accountable. And then again, just highlighting compelling prostitution in Texas. A person commits this offense if they knowingly cause, again, by any means, a child younger than 18 of years to commit prostitution. And it does not matter whether that individual knows the age of the child at the offense. So again, the legislature just protecting our children and making it so that they can be held accountable for their actions.
We wanted to We wanted to talk briefly about suicide. We know suicide is a topic that impacts our youth. I'm going to skip through this slide because I only got about 2 more minutes, and this has a lot of information on it, but just briefly, we want to look at the increase in suicide rates across the US. And if you look at specifically Texas, from 1999 to 2016, we had an increase of 19 to 30%. And if you really look at the correlating activities that's happened during that time, social media is a big factor in regards to, some of these rates and things that are happening with our youth. So, just kind of keep in mind that suicide does greatly impact our youth, and it's something that we need to always be considering. Do you want to do this slide?
Yeah, so these are different contributing factors for suicide, relationship problems, substance abuse, job and financial problems that can kind of be a burden onto the teen if they see that their family is struggling, they feel like a burden, different things like that. If their family is losing housing, they're going through all these hard times. Physical health problems, if it makes them feel different than their peers, our kids with long-term chronic issues, cancer, different things like that can weigh really heavily on their emotions as well. So just those different things, or if there's been a recent crisis in their life, they are reactive, they don't sit back and think about things. They're just really reactive to what's happening around them. So here at TxFNE, we utilize the Ask You screening tool. And so we go through this with all of our patients. Our policy is 10 and up. This version is the youth one, and it can be utilized for ages 8 to 24. So you kind of just go through it and ask. I know this can be a difficult subject to talk about, but it's super, super important to discuss. And even though it can feel taboo or uncomfortable, it's important that you ask these questions and you ask them straightforward and don't try to skirt around it. So the first question is, in the past few weeks, have you wished you were dead? Don't change dead to something else. Don't change kill yourself to anything else. Make sure you're using the direct, straightforward questions, and then talk to them about it. And then discuss, even if they say no to all these things, I just met you, I really like you, I want you to be around. So do you have a trusted adult you could talk to if you start to have these feelings, because this thing just happened to you and it's really big, and you can start to have these feelings over the next couple of weeks. So it's important that you have someone trusted to talk to, and make sure that you know your protocols and policies as to what to do with a positive screening in whatever setting that you're at.
I included the link here just because they have some really valuable, things that go along with their screening. So depending upon your environment, that's really helpful. So I included that in case anybody's interested or needs to implement something similar. And I know we're getting close to time, but just last but not least, just know that teens are tough. Don't be offended if they don't want to talk to you, or if they're closed off, if they're rude or whatever. They're really a tough group, and we're thankful that all of you are in this space to be there to help support them in this period of time. We also kind of need to remember that they're not children and they're not little adults. We have to kind of figure out that space of who are they, how do we talk to them, and how do we make them feel validated and a really important part to their health care and their plan of care in general. So figuring that space out can be difficult as you, especially if you're new to taking care of this age group. But once you kind of figure it out, don't think that you're smooth sailing, because every teenager is different. So just know that every interaction is going to be a little bit different. I always like to just throw this in because I think as older adults, we always want to try to dismiss some of the stuff that teenagers are dealing with. But really and truly what they're dealing with these days is really, really tough. I'm super thankful and lucky that I never had to deal with some of the stuff they're dealing with. Social media in and of itself is kind of an awful situation to have to deal with as you're trying to figure out who you are. So really kind of consider that before you want to judge something that maybe a teenager did, or a decision they made that you think might be, not the smartest. And show them that you care about them. Sometimes they really just need to know that somebody actually cares. Some of these teenagers are faced with really awful situations, and just being that cheerleader or support system for them in that moment can really make a huge impact on their future and how they manage things moving forward. And that is it. We actually made it to the end. I think we have a little time for questions if there are any.
Yes, we have about 5 questions. So the first one is about whether or not a 16-year-old has the right to refuse Plan B if her parents are insisting that she take it.
Absolutely. Absolutely. It's her body. She gets to decide. Her parents really can't force her to take that medication. The dynamics there are certainly difficult. There's certainly reasons why we want to encourage that. Making sure that you're having a one-on-one conversation with that adolescent in regards to benefits and risks and things like that. Really understanding why they're not wanting to take it. This is a conversation that I certainly would be having alone without that parental interaction involved. But yes, they absolutely can refuse to take that medication.
And that kind of goes for everything, right? We're not there to force them. They can refuse any part of the exam, any part of any of their care. We can't force them or hold them down. So I think that's also an important conversation to maybe start with the parent, so they know too, like what the expectations of the exam and the visit are.
Yeah.
Okay, then we have 2 questions about STIs. The first one is if any of your STI tests come back positive, are those reportable to State Health Department or the CDC?
Yes, they are. All of them are. And most of the labs that are, like, for example, our lab partner is LabCorp. And they take the responsibility of doing all of those actual reporting. So we don't do the reporting itself, but the lab company that we contract with does. And so all of those are reportable. That's how the CDC gets their information. If you pull up some of the STIs on the CDC, they can tell you the trends and statistics of gonorrhea and chlamydia and things like that in your particular area or state. So it's really important to have that information.
Okay, thank you. And then the next question is when a victim tells her parents and law enforcement they've never been sexually active prior to the rape, but test positive for an STI at an exam done within 96 hours, is it even possible for an STI to come up positive that quickly?
So they say that you can revert to a positive in towards that end of 96 hours. So really at that 72-hour mark and after is when you can shift from a negative to a positive. So if you're at 96, then the answer would be yes, there is a chance that it could have happened from that actual incident. If you come in 24 hours after the event, then the likelihood of that is no. It's not going to be from that sexual encounter itself. So it just depends on the actual time frame that the specific number on how far out we are. But again, right around the 72-hour mark, you can start to see, tests flip from a positive or negative to a positive.
Okay, thank you. And then the next question is about how can folks best advocate for a more comprehensive sex education program in K through 12?
I think that's a Kristen question.
I would say, get in touch with your State Board of Education representative. That's the starting point, and that's who holds the decision-making power for what goes into that curriculum is the Texas State Board of Education.
I think that's a frustrating piece though, because we know that the school system has, that's really where some of this stuff, and even if it's not the school themselves that do it and they contract with other agencies that come in and really have conversations about trafficking and sex education and all the things that we kind of talked about today. It would be nice if that was, we could have real conversations with our adolescents versus, this fear of the information. I think we're still stuck in this era that we think that if teenagers don't know about it, if we don't tell them all these things, they're not going to figure it out, because that's historically kind of what the mantra was, but with, you know, the internet the way it is and all of that, like, that's just not the case anymore. And so I think we really need to be more open-minded in regards to being proactive at providing information and making sure it's accurate and open.
Okay, and then the last couple are just people interested in getting your PowerPoint. So should they just reach out to you via email?
Sure, I can send a PDF copy.
Okay, great. And then also this recording will be available on TAASA's YouTube channel, probably in January. So if people want to share it, they can do so that way as well.
Perfect.
And that's all of them. Thank you all so much.
Thanks for having us today. It was fun.